Hi there, my name's Karina and I'm an anaesthetic fellow from Sydney, Australia. The aim of this video is to familiarise junior doctors with radial arterial cannulation. This procedure will be relevant for you if you are about to begin a cardiology, intensive care or anaesthetics rotation. Arterial cannulation can be a daunting procedure to junior doctors and can be tricky and fiddly even for consultants at times. Familiarising yourself early with good practice habits can make this task a lot easier, and I hope you find my tips useful. To begin with, I'm just going to show you some angiograms of the radial artery to help you refresh your anatomy. I want to emphasise there are 3 things you should be concentrating on learning in this video. Firstly, the equipment that you need and how to position the patient properly for the procedure. Secondly, to understand how to use the Arrow quick flash catheter as an example of a wire in cannula technique. And thirdly, how to test for successful placement of your arterial line. So let's get started with equipment and positioning. This is a photo of the equipment that I use. Initially, I found it helpful to organise everything into the order in which I would use it to ensure I had remembered everything. Essentially, your equipment falls into 3 groups. Firstly, preparation. On the left, you can see a Chlorhex and alcohol swab to clean the skin. The bluey pictured goes over a fluid bag used to extend the wrist and position the patient, as you will see shortly. The second group is what you will need for the cannulation. You can see a 2 ml syringe of lignocaine 1% there for local anaesthetic, as well as an Arrow quick flash cannula. Make sure you have gauze because it is very easy to make a mess in this procedure. The third group is what you need for securing and connecting the cannula to the transducer and includes a clear bandage and tubing, which may vary from department to department. This is the Arrow quick flash cannula. Take the plastic coating off the cannula itself. As you can see, this black bit at the end allows you to insert the wire through the lumen once you've hit the artery, and then over the top of that you can release the cannula and thread it up to the hub. This is me positioning a patient with her wrist extended over a bag of fluid that's covered by a bluey to absorb any spillage. The wrist is slightly extended but not overextended, and you can either use tape or an assistant's hand to hold the wrist in place like this. I'm now preparing the skin with the chlorhexidine swab. I now just want you to pause this video and see if you can go back and remember the 3 groups of equipment that you need. Once you're happy here, we'll move on to performing the arterial cannulation. So we are now ready to proceed. The first injection you give will be to provide local anaesthesia because this area of the skin is very sensitive. Skip this step, of course, if your patient is unconscious. Can you see here how the extended wrist gives me more space to comfortably approach the artery? I use lignocaine 1 or 2% without adrenaline because I do not want to encourage the artery to constrict. I inject less than 1 ml just next to the artery and then massage it into the surrounding area. Be careful not to aim at and prang the artery with a local anaesthetic needle because it can spasm and or create a hematoma. There's lots to explain in this next clip, so please feel free to watch it several times. Firstly, ensure you're comfortable. Do not perform this procedure without having all of your equipment within arm's reach, an assistant and a seat for yourself. Carefully palpate the artery and take your time doing this. The artery is most easily palpated where it is most superficial at the angle of the wrist. However, it increases in size and becomes less tortuous as you move proximally. You can see this in the angiograms at the beginning of the video. Therefore, it's important to feel the course of the artery because the place where you feel the strongest pulse may not be the best place to cannulate, especially if the patient has had this procedure done many times and there is scarring. If you're unsure, check with an ultrasound, but this is outside the scope of this video. When you cannulate, move slowly. The lumen of the artery in patients with peripheral vascular disease may be less than 1 millimetre. The artery may spasm if you have several attempts, so your first one is always the best. You can see here what a flashback looks like when you hit the artery, how she pushes the wire easily into the lumen and then advances the cannula over the wire. To connect, remove the wire from the cannula and attach to tubing that will ultimately connect to the transducer. This is normally the messy part, not so much today. Here, the nurse aspirates the cannula and easily draws bright red arterial blood into the syringe. Ultimately, transducing the signal to ensure a pulsatile trace is the best way to confirm that you have placed the cannula in the artery rather than the vein. As you watch the third stage of the procedure, that is, taping and securing in the cannula, take a moment to consider those 3 learning points from the beginning of the video. Can you remember all the equipment you need and how to position the patient? Are you clear on how to use a wire in cannula techniques such as the Arrow quick flash device? And do you know different ways you can confirm correct placement in the artery? This video provides an introduction only to arterial cannulation. I will leave you now with some references and recommendations for more comprehensive reading on the subject. Most importantly though, I encourage you to take the opportunity in your term to practice this skill often and also ask your supervisors for their tips and tricks. Thank you for watching. I hope you have found this video informative.